Use damp gauze to remove the residual gel. Step 3. Use the cotton pliers to grasp the gauze isolation and gently pull. All of the isolation material should pull free from the mouth in one unit. The retractor should remain in place. If the gauze is excessively dry, moisten it lightly before removal. Step 4. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove with floss. Step 5. Dry the facial surface of the teeth with gauze. At this time, the teeth are dehydrated and may be sensitive to air. Syringe the satin finish potassium nitrate and sodium fluoride gel directly onto the teeth and allow it to remain for 5 minutes. A complete application requires approximately half of one syringe. At 5 minutes, suction and wipe. Lightly use air to remove remaining material. Now it's time to judge the initial whitening results. With the retractor still in place, use the shade guide to determine the after shade. Document in the patient's chart and with a photograph. Finally, review the post-treatment care instructions with the patient and provide the card included in the kit for reference. Explain to the patient that the teeth are more susceptible to restaining over the next 48 hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages. It is recommended that the patient return for a 48-hour recall appointment to document the final whitening true effect of the Zoom 2 chairside system. This is also a good time to dispense the take-home trays and whitening gel for maintenance care. Additional satin finish gel can also be dispensed to the patient at this time. Section 10. Cleaning and storage. Use any standard quaternary ammonium phenolic-based disinfectant or alcohol to wipe down your Zoom 2 lamp. Do not spray disinfecting agents directly onto the unit. Do not use glutaraldehyde to clean your Zoom 2 lamp. Such materials can damage the coating surface. When the lamp is off, prior to the next Zoom 2 appointment, check the glass in the aperture to ensure no residue from the cleaning fluid remains. Position the lamp comfortably for storage in your office. Section 11. Troubleshooting. To obtain the desired whitening effect and prevent fadeback, the protocol of 3 15-minute sessions must be followed. After 2 sessions or 30 minutes of bleaching time, it is not possible to determine the effect of dehydration versus whitening. A full 45 minutes, 3 15-minute sessions is necessary for the full benefit of the Zoom 2 whitening system. The light will not turn on if the light guide is not in place. The display will continue to read, "Attach guide." Use of the light guide is mandatory to maintain proper distance to the light and maintain positioning at the smile zone. Always cure the liquidam in a sweeping motion. If the light is held in one position too long, the material can heat up, causing discomfort to the patient. Curing in a sweeping motion allows for proper cooling of the material. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember, no pink. Patients with recession are good Zoom 2 candidates, provided the exposed dentin is covered with liquidam. Once the teeth are whitened, the exposed dentin can be bonded to match the newly whitened teeth. Use the vitamin E oil to soothe any sensitive or blanched tissue from contact with the whitening gel. If the vitamin E is applied at the margin after the first session, place an additional application of oil between the second and third session to ensure the barrier remains intact. If there is a concern about excessive sensitivity, give the patient 600 milligrams of ibuprofen prior to beginning the procedure. Acetaminophen should not be used. If there is still a concern post-procedure and the take-home trays are ready, the trays can be used to deliver additional satin finish gel to the patient. The Zoom 2 whitening syringes are packaged separately from the treatment kits. To enhance shelf life when stored, refrigerate the syringes. The gel must be returned to room temperature for use or it may be runny. This can be done by either leaving the syringe out overnight prior to the appointment or placing the syringe in a cup of hot tap water for 10 minutes. Remove the syringe from the water and wait an additional 5 minutes before use. If the light does not ignite, check to make sure the lamp is plugged into the socket designated for equipment. Note the temperature of the room. If it is below 55 degrees Fahrenheit, the light ignition will be slower, with significant flicker until the light is warm. The flickering should not last more than 15 to 20 seconds. Check that the light guide is securely in place on the front of the lamp head. If the light still will not turn on, try substituting the spare light guide available in the marketing box. Warranty. Review the warranty information listed in the Zoom 2 instruction manual. Marketing. Now that you've completed this Zoom 2 training, you're ready to let existing and new patients know that they can have a brighter, whiter smile in less than an hour. For more information about marketing Zoom 2 to current and potential patients, call your Media Services representative at 800-422-9448.